COVID cases surge in Okinawa amid concern over possible medical system collapse.
Here's a summary of the article.
Tokyo. The number of coronavirus infections has been on the rise across Japan again, and the situation is especially serious in Okinawa Prefecture, with one healthcare expert saying, the medical system could collapse as early as next week, where people who need to be hospitalized cannot be admitted. The Ministry of Health, Labor and Welfare announced on June 23 that the number of new COVID-19 cases reported from about 5,000 medical institutions nationwide for fixed-point observations between June 12 and 18 stood at 5.60 per institution. The infection situation in Okinawa Prefecture is particularly serious, forcing restrictions on emergency medical services. The number of patients in Okinawa Prefecture from June 12 to 18 was 28.74 per medical institution, a 4.73-fold rapid increase in just over a month since immediately after the status of COVID-19 was downgraded to Category 5, or the same level as seasonal influenza, under Japan's infectious disease control law. Yoshihiro Takayama, a doctor at Okinawa Chubu Hospital's Internal Infectious Diseases and Community Care Department, pointed out, in addition to the spread of community-acquired infections, there is a shortage of medical personnel due to infections, and hospital-acquired infections are putting pressure on medical care. He added, it is necessary to organize the treatment of patients, such as having patients recuperate at home or at a facility, or treating them at a local hospital depending on symptoms and risk, so that patients will not be concentrated at emergency medical facilities. On June 21, the Okinawa prefectural government asked residents to prepare test kits and fever-reducing medicines in advance and to refrain from visiting emergency rooms for those with minor symptoms in order to protect emergency medical services.
This post received a score of 3,700, with an upvote ratio of 94%. Here are the top comments in response to this article.
Article does not say if this is a new variant, or simply an existing one.
Not sure about Japan specifically, but the current main variants are listed here.
Still the same variants so far, no word of any new ones as of yet. Is Okinawa experiencing such a bad outbreak for any particular reason?
COVID? No, I think we collectively decided we are done with that disease. I'm going to stick my fingers in my ears and walk away from this.
Hear no COVID, see no COVID, speak no COVID.
Well, there's definitely no smelling COVID. Taste, no. COVID, no. Money down.
Just had COVID over the past week after 3.5 years without. It's not over.
My family all got it as well, and it's been more than a week and still got symptoms weird.
Good news, the CDC estimates 1 in 5 adults will get longer-term symptoms from an infection.
Wasn't aware of this. Something to watch out for in a country that doesn't have a lot of immunity from vaccines or natural immunity from their population getting the disease multiple times.
What natural immunity? COVID evolves to new variants within months.
Your natural immunity still helps out somewhat even against new variants. Your immune system has dozens of overlapping immune mechanics, and several of those don't rely on whatever new surface protein variant shows up. You will have full immunity only to the original variant, but you will have partial immunity to the newer ones. Basically, you can still get sick from them, but it will be a much, much milder sickness.
You mean the natural immunity associated with long-lasting lymphocytopenia after recovery from COVID? The lymphocytopenia that means you have fewer T or B cells around to power overlapping immune mechanics? There is no guarantee that a second infection will be much milder. With a long incubation and transmission period, COVID is under no evolutionary pressure to become milder.
Variant attributed?
Greater than Tokyo. The number of coronavirus infections has been on the rise across Japan again, and the situation is especially serious in Okinawa Prefecture, with one healthcare expert saying, the medical system could collapse as early as next week, where people who need to be hospitalized cannot be admitted. Oh dear, it's also still hitting China quite badly. When will this pandemic end?
It's not a pandemic anymore. It's an endemic disease.
Endemic doesn't just mean it's everywhere or has been around a long time. It indicates stable case rates and/or predictable changes. As long as we can't predict the surges, it's not endemic.
This video was automatically created by Reddit to speech. The article and comments in this video were selected from Reddit according to their upvotes, and any paraphrasing was performed by smmry.com, without any human intervention.